I think we can start. Welcome, everybody. This is Eye on Africa. My name is Awasar. I'm Assistant Director for Academic Affairs at the African Studies Center at Michigan State University. Eye on Africa is our weekly seminary series, and we are very happy today to have Robert Kwame Agyarko as our guest speaker. And I'm also very happy to have Dr. Maji Hailemariam here, who is an assistant professor in the Department of Obstetrics, Gynecology, and Reproductive Biology in the College of Human Medicine here at MSU, who is gonna introduce our guests before we start the presentation. So Maji, I give it to you.
Thank you, Awa. Welcome, everyone. Good afternoon. This is a great honor and joy to introduce my friend, Robert Kwame Agyarko. Robert is a global health and international development practitioner and expert on so many things. And more importantly, he worked on global response or continental response, focusing on malaria, HIV/AIDS, Ebola crisis, and most recently on the COVID-19 pandemic response. His expertise is mostly on global public health area, and he does work with lots of actors, including the African Union, the World Health Organization. He's involved with UNHCR, UHPR, HelpAge International. He worked with UNICEF. It's all the names and all the great companies doing great thing all over the world. He's worked with all of them. Was it this year? This year, I saw Robert in Nairobi. He's also an Aspen New Voices Fellow, a senior fellow now. And when I saw him and heard about all his amazing expertise, I believe he would be the perfect speaker for this series. And it's such an honor and a great privilege to hear him speak and to have him join us this afternoon. Please welcome Robert, and the floor is yours.
Thank you very much, Maji, and also thank you, Awa, and Michael behind the scenes for organizing this, and also inviting me to speak. I'm really humbled after hearing all the good things you're saying about me. I wish my boss could hear that for a pay increase, but that's another story. We are talking today, and thank you to everyone who has made time to participate in this talk. It is always a privilege to share ideas with like-minded people and also to learn from others. Today, we're going to talk about public health concerns in Africa, look at some of the challenges, some of the opportunities, and then the key actors and action and going forward. Oftentimes when we talk about Africa, we forget the magnitude or we forget the vastness of the continent. We forget the complexity of it, and we tend to just brush stroke one color across. But it is a continent of different people, different cultures, and different politics, and a number of other things, as well as, of course, the sheer size of the continent, as you can see over there. The most latest information puts the population of the continent around 1.4 billion, which is about 16, almost 70% of the global population. It is the second largest continent after Asia, and most populous as well after Asia, covering 6% of the total surface or 20% of the land area. These may be facts that we all know already, but it's good to establish them. 43% of the population is urban, as almost half, you will say, and then the great majority perhaps are rural. We've seen an increase in life expectancy from 46 years to 56, that is from 2000 to 2019. So there is some improvement in spite of all the challenges I'm going to lay down. There is some improvement in healthcare, in the management of health, and also in the population's health. I want to step back and look at Africa in different ways, and this is how the world sees Africa. So I showed you first what Africa is and where it sits within the globe as its size and core. But there are different ways that people cut Africa up. So you have the African Union, which sees the continent as 55 countries, and I say 55, made up of Northern Africa, Western Africa, Central, Eastern, and Southern Africa. That's how the African Union sees it. It's diaspora of Africans in the Caribbean, in the US, and in other areas. Then you have a nomenclature that came up some 20, 30 years ago, Sub-Saharan Africa. I personally don't agree with it, but that's not the point of discussion today. That looks at 46 out of 54 countries. So it categorizes 46 countries as Sub-Saharan Africa. I mean, where you rule the line of where the Sahara starts and finishes, a debate that can go until we finish. When you look at the WHO also, so Sub-Saharan is the classification used by the World Bank and the UN, and then others. When you look at the WHO classification, because we're talking about health, the WHO Regional Office for Africa has 47 countries. And so here also, it is slightly different from how the African Union sees the continent, and it is different from how the World Bank and go. So when you begin to put data together, suddenly you see that it is difficult data. Sometimes it's not comparable because one source will be talking about Africa as a whole, another will be quoting WHO AFRO office, another will be looking at Sub-Saharan Africa. Classifications are different, but be as it may, from however you look at it, a story emerges of what the continent is and what its health problems are and how we must deal with them. I would like to first establish the global burden of health, and then from there we move on to what it is for Africa. And it would be good to perhaps look at how WHO defines health, which is that it is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The global burden of disease, the latest report is from 2019, and this measures the health of the globe, but it uses the disability adjusted life years, which is DALYs, and I'm sure you would all know how DALYs are measured, which is the total burden of disease, both from years lost due to premature death and also with disability. So here what you're looking at is what is the life expectancy of this person, and if this person died prematurely from a disease, how many years short is that? How many years would they have lived? We can quantify that in terms of income and economics. If the person doesn't die and due to some tragedy is infirmed or disabled and can't work at the rate at which they should have, that is also taken into consideration. So one DALY represents 1 year. And globally, if you look at the burden of disease, you have cardiovascular diseases as the main or the leading cause of disease burden, followed by cancers, neonatal disorders, respiratory infections, and others. Issues around HIV and AIDS and other infectious diseases somehow come down. So I would say a lot of non-communicable diseases are actually what globally we are looking at. When you look at the burden of disease in the context of Africa, a different picture emerges. You have communicable diseases more BN, which is disease that can be transmitted from one person to the other, maternal, neonatal diseases being the bulk. But slowly you can see that from around, I would say from 2000 up to 2009, the non-communicable diseases are beginning to peak on the continent. If you turn your attention to the other side of the slide that you have, where you're looking at what the conditions are, you will see that the conditions, the leading conditions in Africa, are somewhat different from what we saw globally. So in Africa, it is neonatal diseases, children under 5, respiratory infections and TB, malaria, and then the HIV and AIDS and co. So there is somehow communicable diseases and others are the main on the continent. However, the non-communicable diseases ratio is increasing as a result of changes in lifestyle, urbanization, changes in diet, lack of exercise, and on and on and on, with injuries as well playing a key role here. So let's dive down a little bit into Africa's disease burden and unpack what the issues are. In 2015 alone, though the report that we have is 2019, the data that I think it reflects was around 2015, where around 700 million dollars were lost, which is 700 million years as a result of ill health or death, premature death on the continent. You can begin to quantify that in the WHO Africa region. So here you are beginning to see how the data is coming out. Sometimes it's the WHO Africa, sometimes it's the whole continent, sometimes it's something else. But in the WHO Africa region, 59% were from communicable, maternal, perinatal, institutional conditions. I think it speaks to the point I made a minute earlier. And then about 30% from non-communicable diseases, and then injuries, as you saw at the top, were about 10%. Other causes include neglected tropical diseases. Here you were talking about Buruli ulcer, schisto, and others, which are known as neglected tropical diseases, road traffic injuries, maternal conditions. And if you look at the etiology or how these came about, the productivity losses are mainly non-communicable diseases, and then HIV and AIDS and malaria. Here also, the same data presented differently. You see the leading countries also as from 2015. I'm sure when you put COVID on, it will change a little bit, but this gives you a picture of how it looked, I would say perhaps before COVID came on. You can also look at the burden of disease from not only the conditions I have said, where you see non-communicable diseases rising with communicable diseases, but also from age categories. So it's the same data packaged differently. The 0 to 4 represent about 37%, followed by the 15 to 29-year-old. So it is a young continent, but then also it dies young. Right. So we can look at all cause mortality, all cause diseases, but my area of interest and expertise is more in infectious, emerging and re-emerging infectious diseases, and I would like us to dive a little bit into that so that I can share some thoughts with you. So if you step back and you look at from the 1950s until now, these are some of the emerging and re-emerging diseases. So emerging diseases, of course, you would understand that new diseases that are coming up. Re-emerging will be diseases that may have gone, they have emerged before, they have been a problem, they've gone down and they're coming back again, or they re-emerge, as the English says. So starting from the 50s, you was looking at chikungunya, first reported in Tanzania. And since then, we've had it around in different places. Zika virus first reported in Uganda in 1962, and then later outbreaks in Cape Verde around the same year. Marburg, which was mainly an Eastern Southern Africa disease, first recognized in 1967. But recently, I think this year, we've had cases in Ghana, in Guinea, so we are having Marburg in other areas of the continent that we didn't have before. The Ebola virus first in 1976, but since then we have had outbreaks in many parts of the continent, and cases have been transported to other parts of the world. We all remember the 2014-2016 West Africa outbreak, as well as the ongoing ones in DRC, one which was recently just declared over. And then currently we are dealing with an Ebola outbreak in Uganda, if you are following the news. Monkeypox is also something that is, I would say, quite endemic on the continent from the 1970s when the first cases were recorded. Recently this year, we have seen monkeypox becoming global issues because of its transportation to other parts of the world, but it is a disease that has been on the continent for a long time. You can look at HIV and AIDS, first reported in 1981. And I don't have to say too much about AIDS. We all should be aware of its impact, both on the continental scale and globally. But one thing that one may want to say about HIV and AIDS is that while ARVs, with antiretroviral drugs, became available in other parts of the world, I would say in the Western world, it took about 10 years because before ARVs were available on the African continent, and not too different from the COVID crisis, where we saw Africa being pushed to the back of the queue for vaccines, diagnostics, and other things. To follow the trend, meningococcal meningitis also is a problem. If you know the meningitis belt of Africa, you are looking at from Dakar, Banjul, thereabouts, north and south a little, all the way to Somalia, Ethiopia, that side. So it is that middle belt of the continent, and this is seasonal meningitis that comes almost every year. Cholera is an issue, bubonic plague in Madagascar and others, measles, and then, of course, COVID-19. So this gives you a sense of some of the diseases that the continent has been facing over infectious diseases, I would say, over from the 1950s until now. You can also just take a snapshot of the last, I would say, 20 years and dig in a bit more deeply. Here, we are looking at same diseases and others that have occurred, not only in Africa, but in other places. And the ones you see in red are the ones that WHO declared a public health emergency of international concern. So you have SARS in 2003, which was a worldwide event. You have the swine flu or H1N1. You have the West Africa Ebola crisis I spoke about, the Zika 2015, Ebola, DRC, then COVID, and then monkeypox. We are hoping that the Ugandan Ebola outbreak doesn't get out of hand and become a global crisis. So there is a lot that is happening, but perhaps it is important to state that we are beginning to see a lot more of what you call zoonotic infections, as in diseases from animals jumping into humans, about 63% in the last decade, 2012 to 2014, compared to 2001 to 2011, a result of the population growth, as I spoke about, a result of interaction more with nature and deforestation, rural-urban migration and the fact that we are invading the spaces that other vectors and species used to call home, and that interaction is leading to a bit more infections. So having gone from the 50s, looked at the last 20 years, what is the situation today? Today, or as late as 9th of October, this is when this report is, this is for the WHO Africa region. It's reporting 128 ongoing outbreaks. And you can follow this, it's on the WHO Africa weekly bulletin. Week after week, it is not less than 100 ongoing outbreaks, which is from measles to Marburg to cholera, typhoid fever, Rift Valley fever, it's all over the place. Of course, COVID has made everywhere look with a reddish color. Then you have, I think, cholera somewhere in, I think we have cases in Nigeria, I think we're looking at, and then also in East Africa. So imagine 128 ongoing disease outbreaks that has to be dealt with on the continent. We have been speaking about the non-communicable diseases. We haven't spoken about the maternal health and other things. So it is a continent which is constantly on fire, I would say, from the health aspect. If you add other conditions which is caused by either conflicts and co, then currently the WHO is looking at around 149 events, which is 128 diseases, outbreaks, and then the humanitarian crisis. But you begin to get a sense of the magnitude of the problem that the continent faces. So as I have illustrated, Africa's burden of endemic disease is the largest in the world, which is as a result of infectious, communicable, and non-communicable diseases. The example is that for around 227 million years of healthy life has been lost. I spoke about the DALIs, which is annual productivity loss about 800 billion, which is from the WHO. An estimate of 10 million deaths per year resulting from infectious diseases, majority occurring in Africa. But what are the underlying factors? I spoke about population growth. So that is where we are, a continent of 1.4 billion projected to grow to 2.4 billion by 2050, which is 30 years, if my math is right, from now. You have widespread infectious diseases, HIV and AIDS and malaria, which are still endemic on the continent, and then issues around emerging infectious pathogens, prevalence of antimicrobial resistance, which causes a lot of deaths, about 4 million estimated by 2015, and then the persistency of maternal mortality, as well as incident of non-communicable diseases and injuries. So all the maps and all the pictures that show clearly illustrates that this is a continent that has a big health challenge. A lot of work is being done, but we can't run away from the fact that the health security deficit, if I may call it, of the continent is very high. And as if that wasn't enough, with climate change, we should expect these things to grow. I mean, you would all know the planetary boundaries and the ones that we are transgressing or we are surpassing, so I won't go too much into it. But recent information suggests that we are seeing an increase of contagious disease that is linked, faced by humans, aggravated by climatic conditions. And for example, you're looking at climate conditions where the climatic hazards brings humans closer to pathogens, or climatic hazards where pathogens are brought closer to humans. For example, if you look at Ethiopia highlands, where previously you didn't have mosquitoes up high in the mountains, but because of climate change, the climate getting much warmer, you are having mosquitoes in areas where you didn't have. You were also looking at sea rise and how that also some infectious pathogens can happen. There are pathogens that are strengthened by climatic hazards, and then also impairment of human conditions. We've seen heat waves and things of that nature. In all this, the point I'm trying to make is that if the problem wasn't bad, it is going to get much worse if we don't tackle the issues of environmental, climatic, as well as ecological things. So these are some of the diseases that this recent analysis that I just spoke about is looking at. So from warming, we are looking at vectors living longer or moving into areas that they weren't often able to survive in, and you see all the different diseases from chikungunya to others, behavioral diseases, influenza, and others. From precipitation, also you have a number. The linkages are there: waterborne diseases, airborne diseases, direct contact, foodborne diseases, and then the conditions or the climatic conditions that are aggravating and are causing this are also clear. This is an interesting paper that you'll be wanting to look at, actually. So how do you then put the problem together? How do you summarize all these problems, and how do you find solution to them? I think the best way to do this is to look at it under the health system 6 pillars of building blocks, which are first, leadership and governance, the health workforce, financing, medical product, vaccines and technologies, healthcare information systems, and service delivery. This is how WHO categorizes the health systems, and in the various areas, giving you an opportunity to look at different areas and how you can intervene. So on leadership and governance, a recent survey as early as 2019, done by the Epidemiological Association of Africa, supported by other studies, shows that there is a serious leadership and governance challenges, which include weak public health, leadership and management, other factors such as inadequate health related legislation and the enforcement, limited community participation in planning, weak intersectoral action, horizontal and vertical inequities in health systems, inefficiency in resource mobilization, resource allocation, and health information. From the work they did, you can see that health workforce, service delivery, health financing, leadership and management are the key areas of challenges of the continent. So leadership, we're speaking about some of the areas. A dimension that you can't leave out is the issue of corruption, mismanagement, which leads to averting of medicines or just poor management, and also delivery of services. When you look at a health workforce, this you can look at in many ways. You can look at the doctor or physician patient ratio. You can look at midwives and patient ratio. Basically, the human resource that are supposed to see patients. And I'll give you an example. For example, my wife, who is a physician assistant, when she was practicing, she hasn't been for the last couple of years. But when we were in Ghana and she was practicing, on an average day, when she said, I didn't have a busy day, it means that she saw about 50 patients. There are days that she can see 100 and 100 plus patients. So on the continent, it is recorded that we have a deficit of about 1.8 million health workers. And if you look at the data, the most recent data, it is around 2 to 1,000, or 2 doctors to 1,000 or thereabouts. You have on the continent, and in some areas it's even worse. What are the reasons? You have a lack of funding for education and training. migration. A lot of the people that I went to school with who did medicine, I didn't do medicine. They left and went to other places. I have friends who are now the US, in the UK, you name it. That's one. Premature retirement, premature death, given that they are frontline and are always facing death, infections, and other things. But I think we can also look at training. So the continent doesn't have adequate number of medical schools, and therefore, if you add brain drain to that, then you have less people coming out from not only medical school, but other specializations that serve health. And then you have a lot of them also leaving the continent for greener pastures. A third area that you can look at is medical products, vaccines, technologies, and diagnostics and co. It is sad to say that a continent of 1.4 billion people produces 1%, actually less than 1% of its vaccine needs. We rely heavily on imported and pharmaceutical goods to support healthcare in Africa. And it's estimated around 70 to 90% of the drugs that are consumed on the continent, which is around 1.4 billion, are imported. I spoke about the vaccine production already. Although we represent 25% of the global demand for vaccines, our production is very low. We have about 375 pharmaceutical manufacturers in the continent, mostly in the northern parts of the continent, but also some in the southern and other areas. And our imports are mainly from China, India, and co. So in conclusion, we source a lot of our medication, vaccines, and co from other places. And Africa is always relying on the, I would say, the generosity of others through donations and co. And where we have money to buy, others can outbid us and be at the front of the queue. On the right-hand side, you see the import sources of medication for Africa, and the little that we produce also. You see the export destinations, and a lot of it, it's actually within the continent itself. Eastern Africa, Southern Africa, a little bit to the European Union, and on. When we look at health, let me just move something here. We look at the health information system. It is important to just look at what we mean by the health information system. So here you are looking at the provision of data for this decision making at different levels of the healthcare. So this helps in planning, management. It helps in understanding the determinants of health, the causes of ill health, and also public decision making. It helps you to better understand the health challenges based on which planning and financing can be made. And the health information system really comprises of three major domains, which is causes of ill health, responses to healthcare needs, population health status, and others. Across the continent, there are different data gathering systems, but I think demographic health surveys are one, but then you also have the health management information system, which is the main tool that all countries are using to aggregate data for the decision making, to understand how health is being organized and being provided and what the challenges are. So the HMIS is really the integral, I'll say, the engine of health information systems. And if you know the continent, much as it's been digitized, it is and has been behind the times for a while. So there are challenges in the area of ICT and co, but the picture is not the same. It is better in some areas than it is in others. A fourth area is health financing. On health financing, I think it is important to say that as far back as 2000, 2001, the continent's leadership agreed that we should have a standard of contribution to the of GDP to healthcare. And I think then they agreed that they would have 15% of GDP contributed to, or 15% to the health budget. This is called the Abuja Declaration. That was followed by other declarations such as the WHO, World Health Assembly resolutions and co. However, sometimes you have countries coming up to 10, 11, 12%. I've seen previously, but as we speak now, currently, health expenditure, government health expenditure as a percentage of GDP, it's under 6%. So we haven't really lived up to it. You can look at it either by the bars or by the map that I've shown you. So health financing is a problem, and the low investment, lack of comprehensive health financing policies, which leads to extensive out-of-pocket payments, a lack of social safety nets for the poor, financial management, inefficient resource use. And I wanted to quote something on the high health tourism. You can see there, I didn't finish that, but the numbers are very high. I can provide that at a Q&A time, where you have a lot of Africans going out of the continent to India, to Brazil, to other places for healthcare. Actually, a lot also within the continent, I think South Africa, Kenya, and other places. But regrettably, and don't quote me anywhere, where you have a situation where the leadership, the political leadership themselves are traveling out for healthcare, you begin to get a sense that they don't have confidence in the health system that they oversee in their own countries. When we talk about service delivery, here you are looking at how people access health and the quality of care across the continent. Somehow, with all the challenges that we mentioned, or I am mentioning, I should say, this is an area where we see great progress, where the data and also the narrative suggest that the management delivery of services is improving across the continent, as you can see. However, there is very high out of pocket, which is patients having to pay themselves when they interface with healthcare and health service. I think we're looking around 35% of the cost of care. This is the most recent data that we have. So you have government providing services, you have private sector providing services, you also have NGOs, as well as church organizations are providing service. However, the individual, when they have to access health, they have to pay a lot from their pockets. And where you have a continent whose population are said to live under $2 a day, you begin to see where the challenges are coming from. So these are the problems we have discussed. But who are the key actors in the public health space on the continent? I'd like to turn my attention to what is happening in this space. I think we can't leave out the government, and they being the custodians and the stewards of the national development, and of course of health security. The African Union also plays a great part in here. It has set up the African Medicines Agency, which is supposed to harmonize drug regulation and registration across the continent. I'll speak a little bit later about that. Hence the question marks, I will expand on that. The Africa Centers for Disease Control and Prevention, you would know, has been established, I think for the last 5 years, headquartered in Addis Ababa. It has 5 sub-regional hubs across the continent, and it works closely with national governments and also with ministries of health, with WHO and others. We can also talk about the multilateral agencies, the WHOs, the UNICEF, UNFPA, Global Fund, Gavi, CEPI, and others. And then the bilaterals, which are the governments that support donor governments that work with African governments directly, of course, the USAID, UK Aid, and others. Philanthropies such as the Bill and Melinda Gates, Wellcome Trust, Rockefeller Foundation, and others, I can go on, are all operating in this space. Then we can talk about other smaller NGOs, as well as communities and some individuals that are working. So this is the picture of, I'll say, the actors that are providing or supporting healthcare. There is a lot of work that is happening, and I'd like to turn attention perhaps slightly to what, giving all this problem, what is Africa looking at and what are we trying to do? So in each of the 6 areas that I spoke about, action is being done, but for lack of time, I just want to take 1 or 2 areas for us to look at. One area is the vaccine manufacturing on the continent. I spoke about the fact that we produce only about 1% of the vaccines on the continent. And that worry has lived with Africans and African leadership for a while. COVID showed us clearly that without manufacturing our own needs, we would, as always, be pushed to the back of the queue. I spoke about the HIV and AIDS problem as well. So the African Union has set up from 2007 the pharmaceutical manufacturing plan for Africa, which is supposed to help catalyze local pharmaceutical production. We've also embarked on other efforts such as production of the setup of what you call the Partnership for African Vaccine, which was set up in 2021. And then recently also you have the free trade, which is supposed to open up things. But I think more important to mention here is the African Medicines Agency. The role of the African Medicines Agency is to harmonize and streamline drug regulation and drug registration. So currently, if you wanted to register a new drug on the continent, you would have to deal with 54, 55 different regulatory bodies across. What the AMA seeks to do under the auspices of the African Union is to harmonize where you can register with one authority, and then it will give you access to the rest of the continent. It has been ratified by a number of the countries, and it should come into force if it hasn't come into force already. The map you see there are some of the countries that have manufacturing capacity. We can talk about Senegal, that has been producing yellow fever vaccines from the 50s or 60s. I think Algeria, rabies, Tunisia, BCG, tuberculosis, and then you have the others in Southern Africa. There are others, Ethiopia, Nigeria, Kenya, who are all coming up. But what I would say the importance of regulating drugs on the continent and also manufacturing them with quality it's something that if you talk about public health, you must really mention. The first is that a number of drugs on the continent are fake. In 2017, I think WHO found about 42% of all fake medicines reported were from Africa, and other studies suggest that as much as 70% in specific countries are fake. What is the result of this? You have more than 100,000 children in sub-Saharan Africa die each year because of poor quality of malaria drugs, and also big numbers from pneumonia each year for same reason. In March 2019, alert was raised on fake meningitis vaccines in Niger, fake hypertension drugs in Cameroon. Then in August the same year, you have antibiotic augmentin discovered in Uganda and Kenya. But if that is remote, currently as we speak, there is a crisis in Gambia where 69 children have died from acute kidney injury linked to cough syrups that were imported from India. So the importance of regulating the drugs that are coming in is there, but also producing them and ensuring quality of those drugs. So these are some of the areas that the continent is turning its attention to. And we want to ensure that the continent increases its production, and also the oversight on drugs that are coming in is done properly. If one may conclude, I can say that while these challenges exist, there is hope of a better Africa, but action has to be taken at different level. The problems that I have enumerated are not something that can be done by Africa alone. Some of the underlying factors are global. For example, if you look at trade-related aspects of intellectual property, which strips all the right to manufacture drugs which are still under patent, that is an area that the continent has been battling for a long while. For example, when COVID drugs, we have been looking to produce them on the continent, but at the World Trade Organization, countries have refused to budge on that. There is also regional level action that needs to be taken. For example, there are countries that I mentioned that have the potential, are already producing vaccines of some sort, and we can increase their potential to increase more here. It would need regional collaboration. I don't think every country on the continent must or will have the capacity to, but with regional cooperation, you can have countries supporting each other in production in one area and transportation to the other. And with free trade, we should see good movement of that. This cannot be done without private public partnerships. And already we are beginning to see investments there, I think, in the area of vaccines on the continents, in South Africa, in Egypt, and in other areas. And of course, government leadership. If government must put their own money in it, if they committed in 2001 to put 15%, at least that must be paid for the health sector to function properly. I would like to conclude with a proposition that was made by Dr. John Nkengasong, who was the ex-DG of the African Centers for Disease Control and Prevention, who was just left to join PEPFAR. And for them, he was looking at building a new public health order for Africa to stand on 4 pillars, which is strengthening public health institutions, such as the African Union and national health institutions, local manufacturing of vaccine, therapeutics, and diagnostics, as I spoke about, investments in the workforce, proper leadership, training, and then, of course, respectful local international partnerships. So there is stuff that the continent needs to do itself, and then there is stuff that it needs to do with the collaboration of others. So this is a synopsis of the problem. As you can see, it is big. You have to cut a bit of it to present, and this is what I was able to put together to give you a sense of the challenges the continent is facing, but also a flavor of some of the action that is being taken. So thank you very much.
Thank you very much for your presentation. We very much appreciate that. And audience, if you want to ask questions, you can type them. You can also raise your hands and be allowed to unmute and speak. My question is, as you explained, one of the big problem is investment. African governments don't invest that much. So they take these pledges of investment, but they don't follow up. Is there anything that AU is doing or can do, maybe to encourage, to make sure that they actually follow up with their pledges of investment?
I think the AU is doing the best it can. Every year they meet in Addis Ababa, and they have a report of the situation that the continent is going through, not only for health, but for other areas. But when you have the case of health is a problem, education is a problem, transport is a problem, it is always difficult to ensure that every sector gets what it needs. But be as it may, because health is wealth and development, we must always keep the feet of these leaders to the fire and ensure that health gets its needed share. So the AU is doing some, but it depends on individual countries where they see the priority. Somebody has raised their hand. Okay, so there's a question here which says, in light of the COVID and Ebola outbreaks, what one thing do you think we need to prioritize to reduce the threats of these outbreaks? Do you think the solution should be more biomedical or non-biomedical factors? You ask me for one thing and then you propose, so. Can you hear me?
We can hear you. Mm-hmm.
Right. I think, Titi, it has to be looked at it's not only biomedical and non-biomedical. I think it's everything. But you have to start first with your understanding of the risk. So I work for the African risk capacity, and we work in these areas of helping countries to better understand their risk and then also to transfer their risks to the market. You have to have a sense of what is the epidemiology and what is the risk of your country to these infectious diseases. So it would include risk profiling. It would include modeling to understand that. It would include training professionals to be able, epidemiologists and frontline workers. And it would also include biomedical, as you were saying, ensuring that you have adequate drugs and vaccines and co. So it is not one or the other. It has to be all of it together. But if you're not prepared, then it is difficult to act when you have these outbreaks. And we've had them, as I said, for a number of times. So it is about time that we got our act together and be able to be more responsive than we have been. Thank you.
I'm trying to, okay. Monty can speak now, go ahead.
Good afternoon, Monty McMurchie, speaking from Toronto, Canada. The past 10 years have seen me in DRC, and the past 30 years have seen me involved in Africa. And all I can say is the more I know, the less I understand. The more I understand, the less I know. But I compliment you, sir. Health is basic. And my question to you is, everything, sadly, is based on the lack of what I call good governance, governance in service, not exploitation. And how can one, I don't want to say inspire, but how can one motivate, as the French would say, avec pleine puissance, that the government provide adequate resources in terms of water, in terms of preventative medicine, whether it be nurse practitioners out in the field, to mitigate against the harsh circumstances that the citizens are living in for the most part, because health, as you said, is wealth. That to me is the issue. It has remained the issue, and I see no optimism, notwithstanding the various international foundations. It's local, national governance. If governance gets involved and is committed to good health, I believe the situation will be ameliorated over time. How can one do that? I thank you, sir.
Thank you, Monty. Monty, if I had the power, which I don't have, I would say every African politician must use the health service of the country they live in. I believe if you do that, within 5 years, the health will improve on the continent. Sadly, what you've said is true. It's a lack of investment. One can find the reasons because of challenging circumstances and others, but I would say a lack of prioritization is a problem. So the only way we can really force is advocacy, which is what we're doing. This talk is advocating. World African leaders may not be here, but this is what I speak about at every forum that I have the opportunity. My bosses do the same. So we all have to be advocates. We each of us have to be advocates. Take one issue that you are interested in and follow that up. It will be good if leadership across the continent does what we expect of them every time. As I said, it's not the same everywhere. Some countries are better at it than the other, but when you look at the picture continental wide, then the bad outweighs the good, and the indices don't look very good. So you have said it. There's not much to say. Governance at national, community, and regional level, prioritization, proper investments, proper oversight and stewardship will be what we need, and the only way we can do is advocate and keep advocating. I see a question: is there room to upscale both modern drugs and indigenous remedies? I think yes. I know that at least in my country, we have an institute that is looking at traditional medicines for different ailments, malaria, etc., are on the market. So you just have to make sure you have a good regulatory agency that will ensure dosage and mixture and other things adhere to good practice, and population health and security are secured. So of course you have to have both. It doesn't have to be only what you call quote unquote Western medicine. A follow-up to the question of the AU and governance investment, instead of the AU just encouraging governments, do you think it may be important for the AU to actually compel mandate government to allocate part of the AU doesn't have the power to mandate these governments. Unfortunately, governments sign on to these pledges, and it's up to the governments to live up to it. The most you can do is to advocate. Unfortunately, the AU doesn't have the power where it can mandate and go into a government's pocket and say, we are taking this much for, but I wish somebody had that power to do that. Are there any more questions, Awa and Maji?
No, Maji, I don't know if you have questions or comments.
I think something else is coming.
I do. I was thinking about what lessons can the rest of the world learn in terms of pandemic response from the epidemic that the African continent has been effectively responding to, including the malaria.
Okay, thank you. There's another question here. Well, I'll attend to. What can we learn? I think what we can learn is not only from Africa, but I mean, if you look at the whole world and how we responded to COVID-19 or are responding to COVID-19, it is clear that where you are not prepared, you can't act speedily, timelessly, and effectively. So we were all caught off guard. So it is important for us all to learn from this, that investment needs to be made in health systems, and then also we have to invest in preparedness and be ready for even what we don't know, what they're calling disease X. So if there are 3 areas that you want to look at, I would say understanding of the risks that we face and the potential risks that we will face in future based on modeling, based on understanding epidemiology. A second area will be investments in production of vaccines, diagnostics, medicines across, and not the over-reliance of a number of us on a few manufacturers across. And then third is where pharmaceutical companies and countries have made enough money from R&D and vaccines, drugs that they put on the market, perhaps to allow other countries to have the rights, the patents, and be able to produce them. We need to live in a world where we feel it's a communal space, or what the Africans will call Ubuntu, where I am because of you and you are because of me, that we are one, we are interconnected. It takes 6 hours, 12 hours, 24 hours for a pathogen to leave one part of the world to the other. So an outbreak of Ebola in Uganda is not a problem of only their neighbors. It's a problem of everyone, because one flight away, you would have it. So to answer you, the lesson here is that we need to feel for one another. And the only way to do this is to share the resources we have, share the knowledge we have, and invest accordingly to prepare for what we know and what we don't know. There was a question around what is the view on indigenous healthcare systems in fighting health pandemics. I think it speaks to the question around traditional medicines, and I think my answer is the same. There is room for different sorts of for the different kinds of mitigations that we have on the continent, both traditional and non-traditional. In all, you just have to make sure that it's regulated well and there's good oversight to ensure that the providers adhere to some standards and people are not taken for granted and their health are not put at risk. There is a question also here from John Asong, where it says the media, especially Western media, is still painting a negative image of African indigenous medicine from a global stage. How can this be addressed? I think it can be addressed if we embrace our own medicines, our own traditional medicines. And the only way we can do that is, I've said it, regulate it, ensure it's good quality, and ensure that it's safe. And if we are able to do that, and its usage is helping people, then we will be able to counter the negative images or the negative propaganda, if you may call it, from the outside. But until that is done, and until the population itself has faith in the local medication, even not traditional, but made in African medicines, you will have a problem as always. And here you just have to ensure good quality in everything you do, regardless of whether it's traditional or non-orthodox. Thank you.
Do you have any other question or comment? Well, if we don't, we very, very much thank you, Dr. Robert Agyarko, for coming, and for Maji for inviting you. We're grateful for your presence and for sharing with us. Thank you, everybody, and we'll see you next time.
Thank you. It's Mr. Robert Agyarko, but thank you very much. And it's been a pleasure. I hope that I have managed to add to your knowledge, understanding, and also I've learned a lot from the questions. Thank you for the opportunity.
Thank you.
Have a good evening.
Bye, everybody.